taking advantage of the very people that we seek to save to enrich their own pockets. Immediate disciplinary action has been taken against the 2 individuals identified from a recent media expose by Movie TV at the University Teaching Hospital, one of whom is already in police custody. Those who are illegally collecting money from patients for COVID-19 tests or for any other activity in the hospitals, who will not condone them. And I want to thank Movie TV for your role, in making sure that you serve as watchdogs in society. And I urge the public to make sure that you watch over all these abuses and report them quickly as they happen. We have also restructured our testing facility at the University Teaching Hospital outpatient department. We will not allow the image of the ministry or indeed the health sector to be tarnished by a few bad eggs. Internal investigations have also been instituted, extending to several departments at the University Teaching Hospital to identify the full extent of these dishonest dealings. We are also working to ensure that our whistleblower channels continue to encourage members of the public to come forward in such circumstances. We are in the business of saving lives, not taking advantage of our people or indeed our patients. So let this serve as a stern warning to all would-be offenders around the country in all health facilities, the Ministry of Health headquarters, and statutory bodies, that no bad eggs will be spared. We will take stern disciplinary action against all culprits, including instant dismissal as provided for under the Public Service. Allow me to stress once more that all our dealings at every level must be done with total accountability, transparency, and integrity. We are closing all leaking taps and loopholes because we don't want any pilferage of resources, be they drugs, medical supplies, or finances meant for the public. As part of the COVID-19 response, we have continued to ensure commodity security through provision of essential commodities, including personal protective equipment and oxygen cylinders to our facilities around the country. In line with our commitment to ensuring that we safeguard the interests of the public, I also wish to commend the Zambia Medicines Regulatory Authority, ZAMRA, for the action taken against the manufacturers of PHT. There's a tea which was being purported as a cure for COVID-19. So I want to thank ZAMRA for the action taken against these manufacturers of the PHT. And these are unverified so-called COVID-19 cures. And ZAMRA has taken action by closing the facilities of these people who are duping our country, our people. Ladies and gentlemen, there is no cure for COVID-19. Do not be deceived by people who are only out to defraud you of your hard-earned money. I also wish to commend ZAMRA for intervening in Eastern Province against pharmaceutical outlets that were trading in ivermectin, another purported cure of COVID-19, which is actually mostly used in veterinary medicine in animals. I wish to note that according to a report provided by ZAMRA, there has been a reduction in the importation of ivermectin for human use, and that ZAMRA is closely monitoring and engaging with pharmaceutical outlets to ensure that the drug is only used for its intended purpose. Consultations with our colleagues in veterinary medicine have indicated the high use of the drug during this period, and which has correlated with the current increase in parasitic infections in animals. Instead of drugs going to animals, ivermectin, other people channeled it towards human beings, and will not allow that. I urge the public to be wary of undue social media influence to buy into these so-called cures, purported cures. We urge you to seek medical advice and prescriptions from trusted and only authorized sources. I also wish to inform the nation that the Ministry of Health yesterday held a successful engagement meeting with our colleagues from the Ministry of General Education, at which we reaffirmed our commitment to school surveillance and adherence monitoring to ensure our learning institutions are kept as safe spaces of learning for our children and our teachers. We anticipate that the consolidated guidelines that we have agreed upon with the Ministry of General Education during this meeting will be available for dissemination in the coming days and will apply to both day and boarding schools. And let me re-emphasize that schools that are not abiding by these guidelines, be they This brings the cumulative number of confirmed cases recorded to date to 77,171. On a sad note, we recorded 8 deaths from the following provinces: Copperbelt 2, Lusaka 2, Eastern 1, Luapula 1, Northern 1, and Northwestern 1. The 312 active cases, with 5,034 or 95% under community management, and 278 or 5% admitted to our COVID-19 isolation facilities. Of those admitted, 199, that's about 72%, are on oxygen therapy, and 52 are in critical condition. Although we continue to note a marked and encouraging reduction of to adherence to the guidelines, as opposed to letting down our guard each time we see positive gains in our response. And so, as in customary, in closing my statement today, I urge each one to stop the spread of COVID-19 by remembering to mask up correctly and consistently when you're in public. Don't take chances. You have to wear a mask correctly and consistently every time you are in public. Someone said it is very painful to see someone who owes you money not wearing a face mask. So let us make sure we wear face masks. Number 2, maintain physical distance. 3, wash your hands frequently with soap and water or use hand sanitizer. 4, avoid crowded places if possible, particularly super spreader events, or stay at home if you can. And 5, seek medical attention early if you are symptomatic. I wish you all good health. Stay safe and God bless you. Thank you.
Thank you so much, Honorable Minister. In the last 24 hours, 687 new cases were recorded out of 6,255 tests that were done. The country also recorded 8 deaths. This session is now for questions. Is there any from our colleagues from the media? Do we have any questions? Honorable Minister, it seems there's none. May the start conclude.
Okay, so thank you so much. I was taught at school that silence means consent. When no one asks questions, it means the answers have been provided. But I just want to encourage, and the media, especially the fourth estate in a democracy, to do your job. Let us work together to ensure that our citizens are saved right in terms of provision of quality and safe and effective health services. A health nation is a wealth nation. So we value the contribution of the media. And I want to thank once more Movie TV and other media houses for the great work that you are doing in bringing a lot of issues to our attention. And be assured of our open door policy. Because if it's to the interest of Zambians, we are going to act without hesitation on any information that is given to us. So with that, thank you so much, and God richly bless all of you. Thank you.